All right. Hello, everyone. It's MollyAnn Allen with Norterra Family Medicine, and welcome to Wellness Wednesdays. I have a very special guest today, Cassandra van Voorhees, and she is a licensed professional counselor. We met at Arizona State University. We were freshman roommates, so I've known her for quite a while, but she is an ASU Sun Devil graduate. She also did attend Grand Canyon University, where she got her master's in mental health counseling. Is that the right title?
I think so.
Okay.
Yeah.
She also is the owner of Soulful Healing, which is a counseling business, private practice that she started. She believes in holistic counseling. She uses a variety of modalities to treat patients. She's passionate about helping people with trauma and complex traumas, depression, and anxiety. So she uses many modalities, but today she's going to be talking to us about EMDR, which is, if I can get it right, eye movement desensitization and reprocessing therapy. Okay, so it's something she's very passionate about and been helping a lot of people doing. So she's actually going to tell us all about it, and then afterwards I may ask a few questions.
Do a little Q&A.
Yeah, Q&A. But so yeah, go ahead and tell us all about it.
Well, thank you for having me. And one of the things I'm going to say is that I'm going to actually read what I wrote on my computer, because I can go down tangents and we'll be here for 10 hours. So I want to make sure I stay really focused and I get across what I really want to say today. So please excuse the computer, but that's what's happening. So today we're going to focus on EMDR therapy, what it is, and how it works. So EMDR stands for eye movement desensitization and reprocessing. It's an evidence-based modality that uses your brain's natural healing process to treat traumatic or overwhelming experiences. So we can't really talk about EMDR without talking about trauma. So what is trauma? I personally like Gabor Mate's definition. It states, in quotes, trauma is a psychological wound that occurs inside a person as the result of an event. The impacts of trauma can cause one to feel isolated, ashamed, and disconnected from others. There's so much I'd love to share on trauma and its impacts, but what I'd like to focus on today is what happens in the brain following a trauma and how EMDR can help that. So let's say you're 7 years old and you're playing with a friend in your room and you're singing along to your favorite song, maybe playing with some toys, you're having a good time. And then you spill bright red juice all over your new white dress and your stomach drops. And when your mom sees the mess, she yells at you, and maybe she even waves her finger in your face and she screams, "You're so irresponsible." And this feels really awful because our parents' approval is everything to us at this age. Now I could go down the attachment theory rabbit hole, but I won't for the sake of today's focus. But what I would like you to know is attachment plays an extremely vital role in our early developmental years. So that night you go to sleep, and while you're sleeping, you go through different sleep cycles, including the REM or rapid eye movement cycle, which is basically where your brain lights up and processes and stores all the memories from the day. If you've ever seen someone in REM sleep, you'll see their eyes moving from right to left, even under their eyelids. Basically, your brain is sorting out what happened through the day and filing it away where it belongs. So sorting the I had a friend over memory, and that goes in the fun file. Listening to my favorite song memory, and that goes in the music file. Seeing that big smile on your friend's face, and that goes in the I'm loved file. And then your brain reaches the spilt juice on the new dress and got yelled at. And the brain's like, what is this? Because of all the overwhelming emotions that are associated with that particular memory, the brain really does not know what to do with the information. So it kind of malfunctions or short circuits. It gets confused when attempting to file it somewhere. Picture a man or woman carrying the spilt juice on the new dress incident file folder, just wandering around, and then he or she trips and the papers or fragments of the memory fall out all over the place. So the memory never gets stored or filed properly like everything else did from that day. Think of fragments or the pieces of paper within that file as parts of the memory. So what you saw, what you heard, maybe any smells, any feelings you experienced, body sensations you experienced, or maybe even anything tactile that was going on, like wind blowing in your face. All of that are the fragments that are part of the memory. Now fast forward, and you're 25 years old. These old papers or fragments of the memory are still sprinkled around the brain because it never got processed properly when you were 7. So from time to time, you stumble upon a fragment unexpectedly, or they just kind of show up out of nowhere. For example, let's say present day, you go to the store and you experience someone yelling at you, and they wave their finger in your face, and you feel your stomach drop. The unprocessed spilt juice on the new dress memory will also activate from when you were 7, because the unconscious part of your brain thinks, oh, this feels familiar. Maybe it's that red face, maybe it's the pointing of the finger, or the tone of the person's voice, or that body sensation of the stomach dropping. That feels familiar to the brain. This can result in an over or underreaction to a present day incident. So you might find yourself overreacting, feeling like out of control, hypervigilant, or rageful. You might even find yourself yelling or screaming back, and you might even result to physical violence. Or you might underreact and feel like you freeze up or collapse way down deep inside of yourself. Feel small or not all there. You might find it difficult to find your voice or even your legs to walk. You might suddenly feel sluggish or dizzy. Over and under reactions. In a brain scan, if you were asked to bring to mind the spilt juice on the new dress fragmented memory, the activity or parts of the brain that would light up would look the exact same as if they were to scan your brain in the moment it was actually happening.
That's amazing.
This means that the brain struggles to understand what's present or happening right now. So you can imagine when you stumble across the fragments of memory, the brain really struggles to time orient. And it gets confused. And as a result, you actually can experience the same heightened emotions and body sensations as the time of the original event. It explains the disproportionate feelings that are occurring and how we get confused by what we're experiencing, because you might not only be responding to what's happening in the now, but there might be some old stuff that's being activated because it feels similar. So here's where EMDR helps. In EMDR, we gather up those pieces of paper or fragments of the memory and help the brain file them away in a folder. So now you can access the memory when you choose, and the brain no longer stumbles across those fragments by accident. The brain now knows what's in the past is the past, and it no longer gets confused about what's old. The memory also gets filed away with much less emotional intensity. So if you choose to access the memory, it no longer feels overwhelming or distressing. EMDR gives the brain the opportunity to reprocess the memory more effectively, and this is where that R in EMDR, or reprocessing, comes in. We're not processing, but reprocessing for the second time, because the brain didn't get to process and store the memory properly the first time. So in EMDR, we use bilateral stimulation, such as eye movements or auditory cues or even tactile sensations where you can have buzzies in your hands, to basically mimic what your brain naturally does in those REM sleep cycles, but you're awake and alert this time. And it guides the brain into reprocessing the memory to help store it away to help store it in a way that no longer evokes an overwhelming response. Today, there's so much cool information on the brain and body. the areas of the brain that are activated and deactivated during and following a trauma, and how the brain and the body communicate during all of this. But for the sake of time, I'm going to talk about the brain in terms of two hemispheres, just to simplify this very complex organ. So when your eyes look to the left, the right side of your brain is activated. And same goes for when you look to the right, the left side of your brain is activated. So both sides of our brain have vital roles in processing information. Think about the left side of our brain as more logical, focused on making sense of details that are actually collected from the right side of the brain. It's good at organizing, making sense of the past to help inform your present. And it's also where we find language and words to put to our experiences, kind of how we make sense of things so we can tell that story. And the right side of the brain is more emotion heavy. It holds a lot of the emotional stuff. And it also holds images and pictures and abstract thought, and it's wildly creative and adaptive. So during a trauma, the left or logic part of the brain pretty much goes dark, while the right or the emotion side gets highly activated. And this can also signal cascades of responses in the body, including our nervous system, digestive system, endocrine system, and the immune system. So as you can imagine, over an extended period of time, if the trauma or even traumas remain unprocessed, it can have a direct impact long-term on these systems. And we see that today. So again, following the traumatic event, you go to sleep that night, and you don't process the memory effectively during that REM sleep cycle. So that memory becomes locked or frozen in that wonky way where the left or logic is low and the emotional intensity on the right is high. So in EMDR, we pull up or activate the memory, and we ask the brain to do a take two, if you will, to help the brain reprocess the memory in a more effective way. So we activate the memory to guide the brain using that bilateral stimulation. Trip up on that word all the time. So your eyes will move back and forth, right to left, logic to emotion, until what we find is logic side becomes very high. So this might look like a new perspective or a new insight, kind of like a new way of looking at it. You might have a new belief about yourself or about the world or about the situation. This is what we call like the updated or like adaptive information the brain needed when you were 7. So logic becomes high, and at the same time, the emotional distress that was carried in that right, it significantly reduces or can disappear completely. So as a result, you can look back on the memory without experiencing overwhelming emotional or physical responses. So EMDR helps by reprocessing the fragmented memory, putting the fragments or sheets of paper back into the file folder and placing the file folder into the proper file cabinet. This process allows the brain to recognize and understand that the memory is in the past while reducing the emotional intensity and enabling the person to recall the event without having to relive the pain and the distress that was once associated with it. EMDR helps the brain to heal or basically rewire itself, providing, and in term, it really does provide long-term relief from the disabling mental health symptoms clients are experiencing when they first come in. It also increases our ability to feel. It also helps us embody really on a cellular level, what is self-compassion? What does that feel like? Self-love. It increases our emotional flexibility, changes the relationships we even have with our own emotions, and increases our ability to connect to ourselves so that we can better connect to others.
That is fascinating. I mean, it sounds like just a really one of many of your tools that is helpful for patients and clients. So when people come to see you, have they identified their trauma that they have had, or sometimes do they just have symptoms and then you have to, and sometimes a trauma will be found?
Yeah. So depends on the client coming in. I have some clients that have years of therapy and they know exactly their story and where it all came from. And I have other clients that just come in and they say, I've been anxious for the last 10 years and I have no idea why. Or I have some clients that will come in and say, I had this horrible incident happen to me and I cannot get it together following it. I'm afraid to go to work, or, I'm having issues all over the place. So it really depends on the client. It's my job to, first of all, build rapport and safety, so that if we need to go back to memories or experiences that the client's been really trying to stay away from for a long time, it feels a little more tolerable because we have good rapport. There's some trust building and safety building in it. Where I'm going is what you've been trying to stay away from your whole life. Strategizing to stay away from that pain. It makes sense. We want to feel better. We don't want to think about those things. It's painful. And I'm building that ability for you to trust yourself to go back there and look at that stuff.
So how many times do patients need to typically go through the procedure of the eye movements, or is it done, is it just depend on the patient, or is it like on average a certain amount of treatment sessions, and how long do they last?
Yeah, good question. And again, I'm always going to come back to, it really does depend on what the client actually wants to work on. So I have clients that'll come in and say, I've had this horrific motor vehicle accident and I really just want to work on that because it has knocked me off my rocker. So we stay more contained to the accident, and depending on when it happened, because as memories settle, they kind of start integrating with other memories that feel similar. So we can have stuff that comes up that we don't want to. That's okay. We just go back to what we were working on. If I have a client that really wants to work on childhood stuff and it's very, very complex, we're looking at building a relationship and doing the work for as long as you want. And then you can take a break and go off and see other healers and kind of feel your new system in this world. It really depends on complexity and what they're wanting to work on. I'm not going to take a client somewhere they're not ready to go. That's not fair. And also in understanding your nervous system, what it's like to be in fight or flight, what it's like to feel dissociated or in freeze, helps us really form a new relationship with our bodies. Length, I'll tell you, in my practice is a little bit different. Most of my clients come in for extended sessions. So they're seeing me once or twice a week for an hour and a half to 2 hours. Some are 80 minutes. Some, very few, do 50 minutes. But it really depends on finances, how busy their life is. I don't want to take away from their life. I want to add to their life. And I also offer intensives. So a client can come in, we can get a chunk of the work done in a very short period of time, and then go back to some talk therapy, integrating in some EMDR. So really depends on what their goals are, and then I'm going to meet them kind of where they're at.
And can you tell us a little bit about the ACE questionnaire? Do you recommend for like adults to be screened yearly, or what are your thoughts on that screening?
So the ACE really can be done by any practitioner, and it doesn't need to be done more than one time because we're looking at adverse childhood experiences only.
That's true.
So it's already over. It's already done. But it would be, I think, beneficial kind of for all providers. It gives us a little bit more of an understanding of the system that's showing up in our office. And we might be able to kind of be like, whoa, that person had a high ACE score, which I'll tell you what the ACE is in
we should define that, huh?
Yeah, and maybe it's being correlated into some of their autoimmune stuff that they have going on. So the ACE was developed by a doctor with the help of Kaiser. And basically, the short of it, and from what I can remember of it, she was working in an affluent area, then moved and started working in, a not so affluent area. And she was in a family practice. She started seeing, she was seeing a lot of kids. And what she started noticing about these kids is they were coming in with all these crazy diagnoses that she had never seen before in the affluent areas. Oppositional defiant disorder, anxiety, depression, ADHD, and she just kind of tilted her head a little. And so this made her go on, a journey. She came up with what is called the ACE, or the Adverse Childhood Experiences Score. It's, I think, 10 questions. I use it in my practice. I send it out with all my new intake paperwork just because it gives me kind of like that overall kind of looking down view. Someone has a high ACE score, you're looking at complex trauma. Means someone in my family struggled with mental health, someone in my family went to jail, someone in my family made me feel unimportant or unloved. Sometimes they didn't have clean clothes to wear or food to eat. It tells us, it gives you a snapshot of their childhood. And over time, it turns into all of these physical symptoms that we carry as adults. So it can help you better understand your client in a snapshot without being the therapist and kind of going down rabbit holes with clients.
It's unfortunate. So many people have experienced different types of trauma in their life.
Adversity even is just this misattunement. I saw another really cool YouTube video, and a social worker had brought the ACE questionnaire into a prison, and she had everyone form a big circle around her, and she had a megaphone in her hand, and she said, I want everyone to take one step in if you answer yes to the following questions. And sure enough, all of them were like directly correlated to our prison system.
Wow.
To adverse childhood experiences. We only know what we learn in our childhood. We don't know any different. Survival is important. So you can see how it might directly correlate to all of the things.
Well, that was very interesting, everything you shared, and thank you so much for coming. Again, this is Cassandra with Soulful Healing, if you want to meet with her. Thank you so much. There's so much more to learn. I know you use so many other modalities, and hopefully over time we can learn more about those things too. Thank you so much.
Thanks for having me.